Hey guys, my name's Elicia. I'm a business coach for massage therapists and the owner of Massage Champions. Super excited to talk to you today about your numbers. Numbers are something in massage business that we tend to turn a bit of a blind eye on. It's like, no, I just want to help people. I don't do numbers, it's not my thing. But here's the thing, guys. If you drive a car and your petrol light comes on, we don't go, oh no, I'm not a petrol person, it's not my thing. Because if you drive the car, you have to understand what the instruments are on your dashboard. And usually we know that the little red E or the little petrol light that comes on means, oh, we better get some petrol. And you know, the cool thing is, the more petrol you have in the tank, the further you get to go. So as a therapist, when you're running your own business, it's actually really important that you understand your numbers. You need to know what they mean, because otherwise we are basing our business on how we feel. So if you're having an epic week, for example, you feel amazing, like, oh, this is awesome, you know, my business is really going somewhere, this is great. And then you have a really quiet week where people cancel or reschedule or whatever, and you go, oh no, my business isn't succeeding, I don't know what I'm gonna do, it's really hard. And what you want to do is, if you've got the data to look back on and go, oh, actually, every third week for me looks like it's a little bit quieter, and then the fourth week is busier, so I'm okay again, it actually gives you the data that you need to be able to drive your business forward in a way that makes sense to you. So it is really important that we understand our numbers and that we have the courage to take the blinkers off and literally have a look at the cold, hard facts. Because when we look at the numbers, we can see if we need to make changes. Do we need to do some marketing? Do we need to maybe look at our rebooking rate? Do we need to make sure that we're, you know, what is it that we need to actually handle in the business? But that's what our numbers help us understand, and we've got to be willing to just have a look at them and be able to make changes accordingly, just like you would if your petrol light came on in your car.
So I've been lucky, and I talk about I've been involved in conferences. I've keynoted at different conferences, but obviously there's no better place to be either presenting or going to is in your own country. And obviously, you know, MMA conferences are, you know, if you've ever been to one, you'll know how inclusive they are. You know, it brings together therapists from like all walks of our industry, which is fantastic. Always a great bunch of presenters as well, with varying topics. You know, sometimes therapists may go into a conference and go, oh, I'm not really, you know, I don't really feel that hot about that particular topic or that presenter. But, you know, once they give them the time of the day and they understand where they're coming from and they have passion, and once again, it changes your framework. And I think, you know, being in this industry, or any industry for that matter, if you think you know it all, then you may as well walk away from it, because, you know, you always have to expand what you do, you know. And, you know, I've changed what I do over the years primarily by going to the conferences and so forth. You know, we had, you know, John Sharkey out, you know, last year, or no, 2 years ago, and, you know, I mean, he has a great presentation, you know, but I practice completely different to him. But what he value adds to what I do is fantastic. So you're not going to get exposed to those things if you don't go to your conferences. And it's not about the presenters either. You know, at the end of the day, you're there to network with other therapists, regardless of, you know, whether they're from WA or they're from, you know, South Australia or Victoria. And it's an opportunity to sit down with other therapists and go, you know, what do you do? And, you know, how do you do it? And what's it like in your area? And what prices do you do? And what modalities do you do? And wow, I've never heard of that. And usually there's a good bunch of exhibitors as well. So, you know, they're always going to engage with you and see if they can help you in your journey as well. You know, like, you have to invest in CPE, you have to invest in going to conferences, because that takes you out of sometimes your own little pool. You know, you need to expose yourself to different theories, different ideas, you know, different presenters. You know, you're always going to, I mean, you go to those presentations and you go to those conferences, you come away, you're always going to be a better person for it. You'll be a better therapist. You know, even if it's just this one therapist that you learn, you know, something really cool about, you know, one particular condition that you saw, or something to do with your business, or whatever the case may be. You know, there's so much to gain from a conference, especially a national conference. And, you know, food's great. The gala night is always awesome. I mean, I know I've always had an absolute ball at the gala night. So once again, opportunity to let your hair down, and yeah, I can't speak more highly of it.
Hi, I'm Catherine McInerney from Pregnancy Massage Australia. Today we're going to be looking at how we actually work through that shoulder area for a pregnant woman, particularly because if she's got those changes through her thoracic and often that kyphotic curve. So we want to enable a lovely movement pattern, and draping is really essential to keep her modesty in line. So we've got our client here in the side lying position again, and we've got this beautiful bolster which comes up against her chest. By wrapping your arm around and picking up the sheet that comes to the front through here, you'll see through here, we then enable a lovely treatment protocol of being able to mobilise and move through the shoulder area, and I call this the lovely elbow to elbow rest, and giving that beautiful access to come through the shoulder and even into, a posterior position. Okay? So, and then you would just lay your client's hand back down and follow on perhaps into the neck. Thank you.
Hi, I'm Steve from Rock Tape. We're going to show you how to tape for general knee pain, particularly around the kneecap. So we have a piece of tape that's going to go around each side of the kneecap, so we can measure like so, and then we're going to cut effectively 2 pieces of tape of the same length, and we're going to round off the corners so they don't get caught on clothing or towels or bed sheets. Make the tape last for longer. And then we're also going to have a piece of tape that goes across the bottom of the kneecap. And again, we'll cut that round off the corners. Okay, we're going to take our long piece of tape, start at the tibial tuberosity here, just on the outside of the tibial tuberosity, and we'll run around the inside edge of the knee. We're keeping the knee at about 90 degrees of bend as we do this, and just curling the tape around the kneecap and applying onto the top of the quad. The other long piece is going to do the opposite curl. Tear through the first inch so there's no stretch on the tape there. Apply that on the skin without stretch, and then again we're going to curl that up and around the outside of the kneecap and across onto the other side of the quad, always finishing on the skin and not on top of the other piece of tape. And then finally, our little decompression piece is going to go just underneath the kneecap there. So we tear the tape in the middle, stretch it out a little bit in the middle of the tape, apply that down, but no stretch on either end of the tape, that just gets laid on, okay? So around each side of the kneecap, and when we straighten the knee, we should get a nice wrinkly nana knee.
John Sharkey. I'm a clinical anatomist, exercise physiologist, and this is a shout out to all my friends and colleagues in Australia, because I will be back in Australia this coming June 2018 for the Australian Association of Massage and Myotherapy, and I'll be conducting wet labs on the Gold Coast and also in Sydney. So please come and join me. It would be fantastic to have your company. I'll be in Australia for the national conference and presenting a keynote and also doing a workshop. However, I'll also be doing some wet labs with a focus on biotensegrity and fascia. And in fact, I'm here this week at the Gunther von Hagen's Plastineria, which is a famous center in Germany, in Guben. And I'm here for the Fascia Research Society with Dr. Robert Schleip and Dr. Carla Stecco, and we're carrying out original investigations into the morphology and the neurology and the anatomy of fascia. So once again, I hope you'll join me this June. All the details will be on the association's website, so take a look, book your place, and I'll see you in June.
Hey, welcome. Stuart Hinds here, soft tissue therapist. I've also brought along a very good friend of mine, but he's also a colleague of mine, Jeremy Mee, and he's a PT. So thanks for joining us, Jeremy.
Pleasure, Stuart. Thanks for
We're
having
here
me.
at the headquarters, Massage Myotherapy here in Melbourne. So today we're going to be talking a little bit about upper extremity issues and probably more to do with working with either PT or even PT clients. Now, for those of you that are out there in clinic, one of the most important referral people that you can have in your network are PTs, and Jeremy and I have had a fairly long history. I've worked with quite a few different PTs over my time in the last sort of 28 years, and I find it's a really, really an amazing and wonderful relationship in terms of working with their clients, keeping their clients going, and also educating from both ends as well. So today we're going to talk about two particular, I suppose, common dysfunctions that we see when we're dealing with people who are either doing weight resistance training, and also there will be a level of injuries that you do see from an overuse point of view, especially when they're doing cardiovascular type exercises as well. But today we're going to focus predominantly on the upper body. So to begin with, we're going to talk a little bit about overuse syndromes of the shoulder, which are just absolutely 100% plentiful, and they come in all shapes and sizes. And Jeremy's obviously brought a couple of different variations of his own in his own time. So I think we've dealt with subacromial bursitis.
Yep.
We've had some tendinopathic changes, only reactive tendinitis. So we'll talk a little bit about those and what we do with those. But what I do see a lot of is just your general overload issues with working with shoulders, especially people who are new to training programs, and as I was saying before, weight resistance training. So there's a couple of really deadly exercises in there that are just perilous when you're working either with PTs or, God forbid, you're not working with PTs, because I tend to find that's where we really see the really cooked shoulders, if you like. So they develop into those really nasty overuse tendon injuries, which is what everyone wants to avoid. So we will talk a little bit about how cooked they can get. Now, for Jeremy, he never really cooked his shoulder because he's a wonderful PT, he has a really great therapist, and he checks in with his body. And from that point of view, it's always going to be, that will be the guiding light in terms of working with PTs, is obviously educating them on when their clients probably need to be coming in and having, well, whether it be treatment, whether it be just even an overview of what's happening in their programs, which particular types of exercises are really going to be quite perilous for them. And as Jeremy and I have worked out over the years, there are some really, really nasty exercises. One of my pet favourites is obviously lateral raises and front raises. And we see them in the gym all the time, and they're always doing them far too heavy. Not only do they end up with shoulder issues, but probably start with elbow issues as well. Because the biceps and the triceps, obviously they're very, very strong muscles, there's no doubt about it, but when you start doing really, really heavy loads, you're going to overload, well, potentially the deltoid, and then unfortunately it's the rotator cuffs that bear all the brunt there. So they're the issues that we see. So today I'm going to go through about what I normally do with Jeremy to keep his shoulder going, and obviously we tend to put into place, not necessarily a recipe, but we just look at the common restrictions and areas and sites where they get loaded, and probably some of the key muscles that we need to keep on top of, because if we don't keep on top of those, then that's obviously when we start developing these really nasty overuse injuries of the rotator cuffs, and then you blow out, you get your bursitis and all that sort of stuff.
Hi, my name's Kym Finch, and I'm presenting a hands-on workshop titled Stiff Ribs Can Cause Pain in the Legs. Finch Therapy linking stiff ribs to distal muscular pain. I'm the founder of Finch Therapy, and I've been working in the industry for 20 years or over 20 years. I own and operate a busy chronic pain clinic on the north side of Brisbane. My workshops, all of my workshops are interactive and hands-on. So we'll be exploring the link between fascia, muscles, stiff thoracic spine and the rib joints. I think where you'll get the greatest benefit out of the workshop is we will be covering some orthopaedic assessment, but it's more the interpretation of the orthopaedic test results. What does it mean? We'll be looking at thoracic rotation, which is great, and there is an art to doing that in itself. But we'll be looking at, what does it mean? What does it mean when they have a decreased thoracic rotation range? How do we interpret those results, and what do we actually do in order to formulate it into something useful that we can use into the clinic to get long-term treatment results? Early in my career, it became very clear to me that when someone presented with pain, or let's say they presented pain here, for instance, even though they had pain here, it wasn't necessarily where the source or the cause of the problem was. They may have developed, or they may have presented with tight, painful muscles, but it also became very clear that when they presented with these symptoms, that they had segmental spine stiffness as well. So what I've been able to do is I've gathered or collated this information over many years to form a template for the treatment of pain and dysfunction. So what we'll be doing in this workshop, instead of searching for the tight, painful muscles, we're going to reverse the cycle. We'll be looking at assessing stiff ribs, stiff upper ribs, stiff thoracic spine, and then we're going to map them. So we'll use this information to interpret the orthopaedic testing of thoracic spine and map it back to the muscle that's actually causing the problem. And it often is a long way away from where the joint stiffness is. An example, pectineus, so a muscle down in the groin area, upper thigh area. When there's a problem with that muscle, it's often quite tight and elevated and tight and painful. That particular muscle, because of how it attaches to other muscles through fascia, it causes joint stiffness, very specific joint stiffness in the thoracic spine and upper ribs. So what we'll be doing is interpreting that thoracic rotation, the joint stiffness, marrying it together with muscles that aren't functioning correctly, and then we'll do some work with that particular muscle to change the tension all the way up through that connective tissue or all the way up through that fascial link to increase the mobility of the spine. At the end of the workshop, practitioners should be able to complete a basic rib and thoracic assessment. What this will do is enable them to not only treat painful muscular conditions quickly and effortlessly, but will also enable them to increase the mobility and range of rib mobility and thoracic spine. I'm looking forward to seeing you at the Massage and Myotherapy Australia National Conference in the beautiful sunny Gold Coast in June this year. Hope to see you there. Cheers.
Hi, I'm Carrie from Recharge Class. Today I want to give you a little hint around self-care that is not around the releases, is around the strengthening. So this series is good for a lot of this kind of stuff. So when we're massaging and even sitting at a desk, we're in a lot of flexion and we want to then combat that and create a more upright space for us. So one of the first ones would be what I call sitting Superman. So you can do this standing up, you could even do it lying down, where the intention is you want to increase the extension, particularly in that thoracic spine. So in this side view, you'd have, from our neutral position, an extension, and it's really very slight. And I obviously need to use my abdominals to keep that positioning. And it's, again, not so much a flop of the neck, but an extension in my spine, an extension in my thoracic. Lovely. So again, I could do that standing, and again, I could do it lying down. Lying down is wonderful also. Beautiful. So then I might play into thoracic, into our scapula. So you could use anything, a pillow, a balloon. You don't need to use anything, in fact, just pushing your arm against your side. So I want to find a nice position of my shoulder in the first instance. So often I'm a little bit further forward, so I need to reposition myself a little back, finding a nice position, sitting position on my sit bones, and then pushing in for 6 seconds into the cushion, floppy wrist as much as I can be bothered, and then releasing off and repeating again. So I'll do that 6 seconds, 6 times. Again, looking at how my posture slumps throughout that session. Releasing off. My counting's not awesome, but yours will be better. Great. And then the last one is around, it's called a neck pull. So often I get this lovely little line, this little increase in lump around my C7, just from, again, all this flexioning. So I want to try and consider that my neck and my head is one piece, and I just want to be pushing it back. So I lock my hands behind my head, and then I'm pushing with the intention of loading into that C7 area rather than pushing back or anything like that. So again, increasing the strength of my extensors in my cervical spine. Lovely. 6 seconds, 6 times. This is the kind of one that I will do every time I think of it, just to have a little go. This is an important one for me. So it's the kind of exercise that you may not feel like you're physically doing anything, but from a visual external position, but internally you know that something's changing. Lovely. Good luck with it. Thanks.